What an honor to be able to be with you all this afternoon, just before lunch, and to have an amazing panel where we can seriously delve into the links between health and the economy, and what I would say is searching for that virtuous circle, that duality between health and economic growth and health, avoiding the vicious circle that we've seen happening, and truly making the most of what we knew for 3 decades, which was that health is an investment and not a cost. But with COVID, with the pandemic, we now have felt that to be the reality, which gives us a tremendous opportunity to be able to strengthen our health systems, make them more resilient, and think about preparedness as a chance to be prosilient in the work of our systems and the health of our peoples. I'm thrilled to have with us in this panel this morning the Honorable Javier Becerra, the United States Secretary of Health and Human Services, Sarah Llosa, President for Latin America of Merck, Dennis Altswald, Founder and Managing Director of Y4 Institute, Lisa Paley, the Region Lead for North America of GSK Consumer Health, and Guillermo Pepe, CEO of Mamotest. We are going to make the best use of the time that we have, in particular because I know that the Secretary may have to leave a little bit early. And so we're going to go straight into the questions that we've been discussing and thinking about as our panelists share their opening remarks through the questions. And Mr. Secretary, if you'd allow me, I'd like to start with you. And so that we can sort of target our efforts for change, what are some of the gaps that we know remain across our region with respect to health financing and investing in health?
Dr. Nall, first, thanks very much for moderating this session. I'm pleased to be with such an esteemed panel of experts. I will say this, I don't believe we're past the point where we treat healthcare as an investment. We still speak of it more as an expenditure. You talk to any person, I don't care what country they're in, and when you mention to them healthcare, they probably think, I'm going to have to spend some real money. And they don't think of it as something they need to do as a long-term investment in their or their family's health. They have to take care of remedying something that's occurring. I think that happens less in the private sector because you have to survive. You have to be in the black if you're going to be in healthcare. So there's more thought of it being an investment. I think the public sector thinks of it as an investment as well. But we still haven't quite brought together the word finance and healthcare to really be unified together. There's where I believe the work that we're seeing done at the G20 and the World Health Organization, where we're now combining the health minister's work with the finance minister's work, will help us speak more in one language about what it means to invest in healthcare. And from there it works. You start to see more of the public-private partnerships. Clearly, COVID proved to us that no one government and no private sector entity could take care of it by themselves. And so when you move in that direction, have solid public partnerships, you gain more success. And I'll close with one final point. Telehealth probably has shown us how well we can do if we work together. I know in the US, we've tremendously benefited from the work we've done on telehealth. But I know there are parts of the Americas where there's even more poverty, more rural aspects where telehealth could be a real goal to achieve if we can get broadband out to most communities. And so I think the public-private partnership has to really work, but we really do have to get into this mindset of thinking that healthcare is an investment.
Now, Mr. We were speaking a little bit about this, the opportunity to leapfrog that we would never have seen to gain, I would say, 15 years, thanks to the pandemic and despite all the suffering in terms of telehealth and telemedicine. We can see a whole new era for cancer and for some of the chronic and non-communicable diseases that truly plague our region. So without question. With that, I'd like to suggest that both Sarah and then Dennis give us some insight and share with us what are some of the lessons learned regarding the links between strong health systems and economic resiliency, given yes, the pandemic, but these are longer term lessons, I believe. And Sarah, could we begin with you?
Sure, thank you. It's really an honor to be here next to Mr. Secretary Becerra and this esteemed panel, and I thank the U.S. Chamber of Commerce for the opportunity. So maybe just very quickly about myself and who I am and why I'm here. I'm the daughter of an Ecuadorian father and a Puerto Rican mother who emigrated to the U.S. in their teenage years. And so I take this role as the first leader for Merck Pharmaceuticals, we're known as MSD in the region, the first female leader. It only took a century to get here, but I take that responsibility enormously. And that's because, you know, it's not just about advancing women in our region, but of course advancing health. So when I picture the challenges that our people in our countries face every day with gaps in their health care, I picture my grandparents, my aunts, my uncles, my cousins. Those are the faces and the voices that I see and hear. So with that said, lessons learned. I think we are still learning because we're still sort of navigating this pandemic. And I think I'm an optimist, and I hope that this global crisis has really shined the light on what's needed to be able to have a resilient healthcare system in populous nations that should become prosperous ones. They're inextricably linked, health and the economy. And one of the lessons we learned is that we need, you know, strong leadership, coordination across all ministries, health, education, finance, trade, that public-private partnership, as well as with civil societies. We need the right mechanism to do so. And lastly, we need to be able to have the financing, the budget headroom, as well as flexible delivery models with telehealth, with some of the great innovation, for example, from Mammotus that we'll hear about shortly. We need that innovation to be able to reduce these gaps and look at healthcare as a national security issue, if I'm a little bit, and hemispheric security issue, if I'm a little bit provocative. So. Thank you.
So, and I'm so glad you brought up the issue of gender and how we can think about this more as a syndemic. The Lancet has written about this. A series of synergistic pandemics that include violence against women and issues and gaps that we need to close in order to guarantee that we can be more resilient. Dennis, would you like to also comment on some of this?
Yeah, thank you very much for having me here. Congratulations to the organization and to the US Chamber of Commerce that you put health for the first time on the agenda of the CEO Summit. So congratulations to it. It's important in our days. We need to, and that's my passion. I want to foster the paradigm shift that health isn't a cost factor, but a driver of growth, employment, and stability. And we need to establish this view. The pandemic crisis showed how countries suffered of the pandemic who are not investing enough in health. And as an example, in the Western Hemisphere, every $12 is related, of the wealth is related to health investments. And you need to provide such metrics. And I'm super proud that we wrote a policy paper together with Rifat Attoon from Harvard University about a metrics approach. If you can't measure it, you can't fix it. And we need to measure macroeconomic return values to society to give arguments to political decision makers to act. And in my opinion, in our opinion, I would downgrade countries who are not investing enough or below average. And the average of all the OECD countries is 7.5% of their wealth. A lot of countries are investing enough, but others less. And so why should the investing in health is the future prosperity of a country, the future productivity of countries. So rating agencies should take it serious if companies don't, if countries don't invest enough in public or private investing. So then they should downgrade them, and so because we need to take care of our citizens, right? We need to keep them not only productive but taking part in their lives, staying healthy, and that's we need matrices, and we need to position health as a macroeconomic sector. Statistical authorities should report about the GDP contribution, the impact on a labor market in every country. And last sentence, I'm a little bit scared. I was invited to Washington to the G20 meeting, to the G7 meeting in Berlin, because Germany has a presidency in the G7. And I got to know, even though that we are still in a pandemic crisis, there are other topics more important than health, and that scares me. We have seen what Mr. Blinken said, that the pandemic crisis would have decreased the GDP by 30%. The next pandemic will pop up. So we need to continuously invest in health and smart investment, and we need matrices where to invest, and maybe we need to reallocate budgets. That's it.
So this is the idea of pro-resilient health systems, of course, being proactive to change as well as managing and strengthening structurally what they are about. And I couldn't agree with you more. The idea of evidence-based reform, and I would say also evidence-based advocacy, evidence in patients' hands as well, in order to guarantee that we are really pushing through the system in the way that we can have those voices. Mr. Secretary, could you share a little bit more thinking about where we are globally as well as regionally? We've seen multilateral efforts to coordinate health and finance. You mentioned that important link, that important ongoing conversation between ministers of health, ministers of finance, bankers, and others. The G20's Health and Finance Ministers Task Force, of course, is one. Could you share with us, discuss some of the importance of a regional approach and coordination for health investment in the Americas?
Well, we know that something like a pandemic, COVID, hits everyone. So we're not safe in America until everyone is safe around the world. And certainly, if that's the case, then anywhere where we are within our family, and the Americas being one family, we have to make sure we're working doubly hard within our own region to protect the people that we have. And so more and more you're seeing that, whether it's G20, whether it's the WHO, the attempt to try to work together on these things so that we can cover the gaps that exist in some countries and make it so that we can make major investments in ways that help everyone at the same time. I will give you one quick example. We are preparing to announce this week that given our experiences here of reaching out to communities to try to get them vaccinated in a way that got us to everyone, including those that oftentimes are excluded, we're now going to begin a core, a service corps. We're going to call it the America's Health Corps. And what that will entail is an effort using Bajo as the base. And we're going to try to make sure that we can get, if we're successful, up to 500,000 new healthcare workers throughout the Americas to help us cover the gaps that exist throughout the hemisphere. And if we do that, just as we saw in the U.S., where we were leaving communities behind when it came to vaccination, if we work harder by getting the personnel to the places they're needed, we can probably have a healthier America overall within the hemisphere. And so something like this, creating this America Health Corps, that could get us a little bit closer to really making sure that no one is falling behind.
So I can only say that the University of Miami, my university, está a sus órdenes. We would be delighted to be part in our Hemispheric University Consortium. I realize that the universities, all of our universities, our higher education systems need to help with that, and I'm sure and know that you can count on all of us in any language that we can be supportive.
We'll call on you.
We're looking forward to it. Mr. Secretary, I know you may have to leave, and I wanted to, there's something I was going to end with, but I do want to throw it out. I think fundamentally, we all believe that we need more money for health, but we also need more health for money. What are those key areas where we can guarantee that we can get the efficiency, but also convince those who can write those checks, public and private, to be investing in our health systems?
And I'll be brief because I know we have other panelists as well. I would say two things. One, as we saw with telehealth, there are ways to reach populations and increase their health outcomes and better their health outcomes without having to do it the traditional way. So thinking out of the box. The second thing I think is important to recognize that we have to think in terms of prevention. We always think of remediating. My mother would always tell me, mejor prevenir que remediar. That has forever stuck with me. It is so much easier. Frederick Douglass, a great American leader of a century and a half ago, African American, said, better to build strong children than to repair broken men. Same concept. It is time for us to think in those terms, because the more we work up front, and have a healthier population, the wellness is cared for, the less we'll have to remediate and try to cure what's ailing our countries. And so we can do this. We can do this.
So I can say absolutely. Please, thank you.
And I want to excuse myself and let the panelists move forward. Thank you very much, Felicia.
Thank you so much, Mr.
Thank you, everyone here in the chamber.
I can say, speaking about preventing, the Secretary was more than on time trying to prevent this from happening. Thank you. So let's go, and building on what Secretary Becerra has shared with us, I wonder if I can ask Dennis if you have any additional comments regarding, and you did say already something about the G7, G20 meetings. Anything else you wanted to add to that?
Yes, thank you for the second question. I think everyone is got to know in the pandemic crisis that health is an important topic and that we need to invest in health. WHO, IMF, World Bank, everyone is convinced that we have to do something also to be resilient in the next years and decades. The question is, how can we establish more evidence-based metrics? And it's not about, the metrics shouldn't guide politicians to a solution, but they should support them taking right decisions. And I would say we need, on the one hand, establish the health economy as a macroeconomic sector, what I described before, but we shouldn't forget about the USP of the health sector. Everyone in the health sector tries to create better health. Everyone. And so the better health creates more wealth. And coming back to your point, better health creates more money, and we can invest even more. Right? And so I think we need to embed the social perspective, the social perspective of investing in health in the SDG Goal 3. And we need to think about disease-specific matrices. Mm-hmm. Because in every country there are different diseases we need to tackle. And I think we need to redesign healthcare systems by trying to avoid diseases in different countries, in different disease areas. And then if we set a target as an example, and Mamutessa, I'm impressed of your work, if we would, as an example, have a target to reduce breast cancer burden in Ecuador by 30% in 2030, then we can think how we can follow the patient journey, how can we prevent to achieve this goal, and then maybe governments and stakeholders are not restricted to budgets on an annual basis, but they may try to think in targets and investments, long-term investments.
So across the continuum of care,
yes.
And you speak my language when we speak about breast cancer. We'll go back to that without question as someone who has surviving with that disease. And I'd like to give for Sarah and then Guillermo a chance to go to examples. We want to get concrete. Examples, investments in health and how they've impacted economic recovery. And would you like to go first and then go back to Guillermo?
Sure.
Which order?
I don't know. Sarah?
No, please, Sarah, and then over to Guillermo.
Yeah. Actually, well, thank you very much. I totally agree with most of you and your opinions. As an entrepreneur who is on the field, who is every day fighting to democratize access to health for women in Latin America, I totally agree with the idea that it's a vicious cycle. Healthcare, it's in a vicious cycle, it's reactive, it's old right now, it's antiquated, it's behind every other sector in terms of acquiring and using technology, and this is a very important aspect in order to change healthcare for good. What we need to do is take this opportunity that we have after a COVID pandemic and start to fully immerse in the digitization of the system. And why? Because we need data, we need metrics, we need information about the system, and we need 100% traceability, in our case, of women. We have to go from awareness to high-quality diagnosis, and then patient journey follow-up, and make sure women complete treatment. In the beginning, we were really obsessed about high-quality diagnosis and access to high-quality diagnosis, only to find out that it wasn't enough. Because many times in Latin America, women would get diagnosed, but after that, they cannot, follow on with the treatment. So they need assistance and they need support in order to, complete the entire patient follow-up. That's why we are developing and implementing technology. In order to do that, I believe we are maybe the first solution in Latin America that is doing this. I'm happy and I'm very optimistic about the data we are going to collect for Latin America. This is the first time in Latin American history that this monumental amount of data is going to be collected in order to fix the system. You cannot change or fix what is not measured.
Could not agree more. And the amount of data that we can manage and collect is absolutely huge. Lisa, I wonder if you could speak to that and also to the next question we had. And so then we can move through to the last. And so that, but also tell us a little bit about actions that you believe governments can take to either invest more of their own funds or to attract more and better private sector investment and in partnership. And maybe address either of those two questions. Please go ahead.
Okay, maybe a little bit of both. I think, at GSK Consumer Healthcare, we're really representing brands in everyday health. And we're in the middle of this transformation to be a standalone everyday healthcare company that is better everyday health with humanity. And I think these things have to really go hand in hand in order to get the best out of both. And we work very closely with not only making sure that consumers can feel better, so they can do and stay productive, to your point, it also takes a lot of stress out of the medical system, and that is another form of productivity. So we're really pleased, to be working with, in the case of the U.S., partnering with our associations and our government on policies. For example, we put some things into the CARES Act, which was the COVID Relief Act, that allowed for discounts to be used from health savings accounts, from flexible spending accounts to cover these everyday needs, which again, then people will be more prone to do. We surrounded that with technology and education, created the microsites, because it's one thing to get the policy through, it's another thing to help people understand with their humane, heart, how to use it and how to do it, because it's really complicated and we need to just break these barriers down, and so that we can be overall more inclusive and also just continue to take the stress out. While the economic benefit that we know on this is for every dollar spent on an over-the-counter medicine, an OTC, we save 6 to 7 in the healthcare system in total. For the US, that was over $100 billion per year of savings. This is meaningful. We have to get better at making these things, known to many, many more of our consumers.
So we have a question that, I'm going to start with you, but I think we may be able to go across the panel as well, which is, we've talked actually more about opportunities than challenges, although certainly challenges that patients face. But where do we start? Where do we ask our health leaders to start? Where do we ask the private sector to start? Would you like to start again? Then we're going to go back across the panel.
Yeah, sure. Thank you, Felicia. Well, the public sector, I would say, as Kamala Harris said before, has to be focused on expanding its capacity and reach, and the private sector has to focus on using our expertise on the field in order to get better outcomes, better results. But the main point here, especially for Latin America, and this is what I'm feeling right now, what I'm seeing right now, it's that in order to attract investments, private investments to Latin America, you need this data. And then that's kind of a vicious cycle where, because there is no data, there is no investment. So we have to gather all these data, metrics, and information, and for this, technology adoption is key to success. We have to really focus on adopting technology and optimizing the whole process, the entire process of the patient journey from, as I said before, awareness, diagnosis, and patient follow-up. And that's really important. Once we start having those metrics and data in place, investments will come. But the main difference, and I see it every day when I go and talk to funds, right now we are fundraising, and most of the funds, they don't know about healthcare. They don't know because they see stories in terms of numbers and metrics, and with healthcare, it's not very clear where those numbers and metrics are and how you can, put all of them together. It's like, for them, it's like investing, putting money in, and wishing for the best. And what they want to have is, the assurance that there are going to be outcomes, that we can make things better and have healthier, happier, and more productive citizens.
As do patients, when they put money in, want exactly to know that they're going to be okay, that they're not going to suffer catastrophic and impoverishing health spending. I think that leads exactly back into what you were sharing with us. Do you want to comment on that?
Yeah, I think, we see these continued opportunities to bring data to the structure in order to enable more spend in the right areas. And I'll use an example of oral health. Oral health is very much a systemic issue. And if you take the data, and we were taking this at the state level as an example, but really, dentists weren't willing to spend their time and energy there because they weren't getting good reimbursement. But there is a real underserved population. But by aggregating that data and making it available in a way that people could understand it and digest it, state by state, we're starting to get more and more support. So we've gotten, like 20 million, for example, in the state of Maryland. We're working on 30 million in Virginia. These are meaningful differences because if you make the consumer better, the patient gets better. And the data is the same, whether it's a consumer experience or a patient experience. It's the same person, right, that we're surrounding with the information and the things that we're doing for them.
I'm so glad you brought up oral health. And now, is there any particular examples, any comments on what we've been hearing?
Thank you. So maybe just a comment, in addition to data, which I absolutely agree that we need the dialogue. We need to be able to come to the table and help governments prioritize because, you can invest, but you can't invest everywhere, right? So we need to have that dialogue and that partnership so that governments can help manage, right? How do you address unmet needs of chronic everyday diseases as well as prepare for the next pandemic or the next hurricane or the next crisis that hits the country. The other piece of that is also ensuring equitable access, right? Making sure that care is for everyone. And so these are areas where we need to have an active ongoing dialogue and leverage the private sector and all our expertise, all our data, right? That's where we can help the governments coming together with civil societies. So I hope, selfishly, that is a deliverable that comes out of the summit because it's not enough to talk, right? We need to put the passion, the energy, our hearts, efforts, and dollars behind the action here to make things better.
So I'm glad you talked about the passion, the passionomics, and also that incredible need to all be able to sit down together, not just say private sector solve it, but you can't sit down and talk with the rest of the actors. That is no longer going to work. Dennis, I want to make sure we have just at least a moment to go back for sort of a lightning set of questions. But Dennis, do you want to start with that last word?
Following your idea of the dialogue, I think if we talk about health as an investment, we need to place health in all policy areas, right? We need to place it. Actually, our former chancellor in Germany, Angela Merkel, implemented this format meeting with the health ministers and the ministers of finance. I would suggest to invite even though ministers of economical affairs.
Absolutely.
So, and we need to measure return on investment, so that we support political decision makers where to invest, right? Absolutely. In prevention, in this disease area, in another disease area. So that they need to think in targets. So that's maybe that like carbon emissions, the reduction. Why shouldn't we have a goal to reduce different health topics? And yeah, maybe then we can finance it with social impact bonds.
Intersectoral action. I'm going to think that we have one last comment each. And please, Lisa, start, and then Guillermo, and then go back to Sarah, please.
Okay. Well, actually, yeah, maybe I focus too much on the numbers and data and metrics, but I totally agree with that dialogue is really needed from private and public sector. For example, in our case, to defeat breast cancer, we actually need both working together, hand in hand, and trying to solve solutions. So what we need, in my opinion, from public sector in order to make this partnership a success is just putting designing and implementing the policies we need in order for the private sector to start investing and developing solutions.
Lisa, one last word from you.
I was going to focus on humanity because I think, we started with, I'm the first woman, and there's so many people that got exposed for those vulnerabilities during COVID. I think we all need to be much more aware across the hemisphere of being inclusive in the way that we approach solving the problems.
That's great. Sarah, last word?
I just think that if we work together and collaborate, we will be stronger tomorrow because of the work we put in today. I'm an optimist.
As am I. And so one last thing is to say, I think we have an opportunity to turn suffering into strategy and do what we knew we should have done a decade ago, but we can do now. Thank you all very much. Thank you to the CEO, to the summit, and we are thrilled to be able to be with you. Have a good afternoon and enjoy your lunch.